morning, everybody. It's 10:30. I'm Councillor John Ogle, for those who don't know, the chair of the committee, and I'd like to welcome you all to this meeting of the Adult Social Care and Public Health Select Committee that is being broadcast live and recorded for publication. So, item 1, the minutes have been circulated. Is it your wish that we accept these minutes as a true and correct record? All those in favour? Thank you very much. Apologies for absence. Are there any apologies for absence?
Chairman, I have apologies from Councillor Hinshaw for other reasons, with Councillor Full substituting. Thank you.
Thank you very much. Declarations of interest. If any councillor or officer has an interest in any matter on the agenda, you should declare it now. Please raise your hand now if you have an interest to declare. No interest to declare. Item 4, Nottinghamshire Healthy Families Programme Long-Term Delivery. I wish to welcome the members of the Children and Families Select Committee who have joined us today. Whilst this service is provided through public health, it has a significant impact on children and families, and as such, members of the Children and Families Select Committee have been invited to contribute to this item. I now ask Councillor Scott Carlton, Cabinet Member for Communities and Public Health, to introduce this report.
Thank you, Chairman, and good morning, colleagues. Just before I go into the report, and with your indulgence, Chairman, it is a shame that Councillor Henshaw is not in the chamber this morning, though I do think we can probably appreciate why, given his daughter's double gold medal success at the recent Paralympics, and certainly on behalf of members present and on behalf of the administration, if the Labour Group members could convey our congratulations via Councillor Henshaw to Charlotte, would be deeply appreciative. Thank you. So, down to business, Chairman. So I come to a select committee this morning on the future arrangements for the long-term delivery of the Healthy Families Programme. Just for a few moments, I will talk at you, but I do feel, given the significance of this contract on behalf of the County Council, that I'll give you a little bit more detail and background. So, the Government's Healthy Child Programme is the national evidence-based universal programme for children aged 0 to 19. The Council has a statutory responsibility to provide this service, which is locally delivered as the Nottinghamshire Healthy Families Programme. And we currently have a contract with Nottinghamshire Healthcare NHS Foundation Trust to provide the service. That contract is due to end on the 30th of September 2025, following a key decision taken by myself as the Cabinet Member on the 8th of May 2024 to extend the Council's contract. The extension enabled the Council to take into account the Care Quality Commission and any other regulatory bodies' actions and recommendations relating to the Trust, and to consider the best way of delivering the Nottinghamshire HFP in the future. This report presents the results of a full and thorough appraisal of all the delivery and procurement options that are available to the Council. The appraisal reviews the options of service delivery, i.e. how the service is delivered, and procurement rather than options for the model of the service, i.e. what we want delivered. It is assumed that the service model for the Nottinghamshire HFP will reflect the model that underwent consultation with members of the public and elected members via overview committee. It is acknowledged that all options come with strengths and weaknesses. Following the comprehensive appraisal of options, undertaking a competitive tender process for a single integrated service is likely to emerge as the preferred option. This would provide the assurance that the market has been fully assessed via a well-recognised and transparent process, and enable an objective of potential providers' ability to deliver a service that is integrated with both the Council's early help system and relevant NHS services. It is also likely to be proposed that a contract of 3 + 2 years would be awarded, bringing the maximum contract length to 5 years. Whichever option is approved as a key decision by Cabinet, the service specification will ensure that the service considers exploration of new models of shared service ownership, governance, partnership, and enables integration with current NCC services and other local NHS services, including as a core delivery partner of the Family Hubs network, and allows the flexibility to respond to change and continue to transform to the needs of our residents in Nottinghamshire. The service specification will also continue to include the enhanced contractual measures and mechanisms to provide ongoing performance and quality assurance. Given the tight timescales for procurement of a new service, it's fully recommended that soft market testing is undertaken prior to the Cabinet key decision, which would still fully consider all options. Therefore, it is recommended that the report detailing the options before you today, it will be received, and secondly, that I invite comments from members here present. Thank you, Chairman.
Thank you, Chair. So we bring to you today. Hopefully, you will see a very thorough options appraisal, and Louise and Helena can go into a little bit more detail if members would find that helpful for them. We're really keen that we understand that we need to have the best service for our families and children in Nottinghamshire, and we know that this has been a journey that we are planning to take here, and we continue with that. What we have got here is something that we're hoping to give as much open and transparency in terms of the approaches that we're looking at, the rationale behind where we have come to our thinking, and then open out for comments and consideration today. Chair, really keen to see how the committee feels in terms of whether they would like a little bit more detail in terms of talking through our rationale, because Louise and Helena are absolutely here to be able to provide that if they would find that helpful.
Much. So let's ask the two ladies who just mentioned if they've got any key points they wish to put out straight away.
So, thank you, Chair. So just to add, and then we can get into any questions. That this replaces the previous options appraisal that was done back in 2023, and one of the key reasons is that the procurement regulations have changed. So the things that we were able to do for procuring health services are now different. So our options available are different to those that were presented back in 2023. And as you've heard, we've reviewed many different options, but you've got summarised in the paper the kind of 4 key options, and they're the ones that have gone into lots and lots of details, including a thorough and robust scoring, independent scoring of all of those options to bring to you what our current thinking is around a preferred option, which is that competitive tender, enabling a fully transparent process to provide assurance to the public and to yourself as members that we've assessed all the providers possible in the market to get the best service for our families. But nothing else to add. Thank you.
Some recommendations which I'll, because we need to focus. The report detailing the options appraisal undertaken for the delivery of the Nottinghamshire Healthy Families Plan be received. Members comment and consider if there is any feedback they would like to give in advance of the Cabinet key decision on the options appraisal that has been undertaken and the plan to commence soft market testing. So I move the recommendations in the report and seek a seconder.
Yeah, I'll second that, Chair.
Thank you very much. I'm now going to open the floor to debate. Yes, Councillor Carr.
Yes, thank you. This is quite complicated, but necessarily so. I think it's a very important subject. From experience of having an old, what was now a family centre, used to be Sure Start, actually in my division, there's always been a bit of a danger and a risk in splitting age groups to different providers, and because you lose continuity for the child, it gets to 5, and then all of a sudden, completely different people are looking after them. So I would favour actually having a single tender from 0 to 19 where possible. And I understand that that might be difficult in that you might not get anybody tender for that whole age group, but ideally I think that would be the best thing. I would prefer, if possible, that we did it from within the council, but I understand that that is possibly going to be difficult as well. So I would actually prefer to see either option 1A or option 3 to keep that continuity of care for the children concerned.
Thank you, Councillor Carr. Councillor Fowle.
Yeah, thank you, Chair. First to say thank you. This is a really thorough options appraisal. I don't think I've seen anyone quite as thorough, quite as good as it. I think it's great. So thank you very much. It clearly, the objectivity and the thoroughness and the scope of it, I think, is very good. So thank you very much. I must confess, it is, as Councillor Cardew said, it's very lengthy. So I can't say, I don't want to test on it, if you know what I mean. But actually, it read very well and it's very interesting. So that's fine. Okay. So I've just got 1 or 2 questions for you. A while back, and you may be well aware of this, one of the things that we called in was actually the health visitor service. So one of the things I wanted to say, I mean, if you this is paragraph 7 on page 12. It mentions 5 universal health visitor reviews, and I just would like to keep this going. It's something that we feel very passionate about in Labour. These need to be face to face, yeah, and that needs to be part of it. I think it's absolutely crucial from a safeguarding point of view. Well, I don't need to make the argument to you. I'm sure you understand it. Okay. Okay. So a little bit further on. Yeah. I mean, it would be interesting to see under paragraph 14, third paragraph down, what the key performance indicators might be. I suspect there's an awful lot of them, but if you could just see the key ones that would go, the main ones that would think would be quite helpful. I'm also very concerned about partnership working, particularly between councils and the health service. And I don't think I'm alone in that, am I really? So where it says towards the bottom of that, those bullet points under paragraph 14, work to ensure that the Nottingham HFB addresses the need for close integration with the council's early help offer. I'd like to understand a little bit more how that is going to happen and how are we going to, how can I put this kindly, how can we make sure it happens when perhaps there's a bit of reluctance? Can I perhaps leave that on there? And again, the bottom paragraph says consultation with stakeholders. With whom? Will it include families and service users? Because clearly I think it should. Paragraph 15 mentions the rapid review of the Mental Healthcare Trust at NHFT. I assume, but please correct me if I'm wrong, is that with reference to the recent further inadequate finding of the CQC around some of the most recent events that I won't list here? Because certainly I know we are very concerned here about that particular trust, given what has happened over the last 18 months or so, and we'd like to be assured that actually, if we do end up going in that direction, that actually there are safeguards in place, given some of the failings of that, very serious failings of that trust over the last 18 months. Yeah, okay. I think that one. Just 1 or 2 other things here. I think the other thing, again, I could ask you a whole range of questions, but again, there's a bit in the appendices on page 35. Again, talking about those partnership working in joined up, coordinated manner with both NCC and local NHS organisations. Again, that's something that certainly concerns me, and I know it concerns some of you too, so I just wanted to raise that as well. The other thing that, and actually it comes back to some of the options, I suppose, if I can find it, if I can find the right page. There's reference.
Yeah, we've asked several questions, Councillor Fowle. Do you think we ought to get a response?
Just one more, and then I'm done. Okay, that's fine. There's reference in here to suggest as well. Here we go. Yeah, sorry, Chair, I'm finding it. On page 27, it mentions outsourcing, and that the report found this is a government report, found no examples of rigorous comparative studies that compared the cost and quality of services before and after insourcing, nor that any robustly assessed project savings have been realised. So there's been no research done to find out whether insourcing is better than outsourcing. At first, I think that's extraordinary. Why is that not really the case? And if that's something that is a barrier to actually having some really good service provided in this council, that's something I would certainly put my hand up for. And I think certainly around, and I think as well the final thing is, I think anything we can do to include some of the kind of smaller organisations and SMEs in this, given some of the difficulties there, I think has really got some really good work going there about SMEs, some of which are struggling, that could actually really make a fantastic contribution towards this. Whereas if we go for a big overall provider, we could lose some of that local expertise, which of course will impact on all sorts of things, including the local economy and local jobs. Thank you. Thank you.
Thank you, Councillor Fold. Councillor Carlton.
Thank you, Chairman of Advance. Thank you, Councillor Fold, for your questions. I will pick out a couple of those that I will respond to, then I'll ask Louise and Helena to come in on the other ones. Certainly, picking up on your wider concerns around the trust and our current position, without the risk of sort of prejudging any final outcomes, of course. Absolutely understand why, from a name point of view, that those concerns arise. You only have to pick up the newspaper to read some of those horrendous stories, which have also recently landed in the courts with charges and outcomes dispensed. That said, I would also remind committee this morning that we are purely talking from a Healthy Families programme, whilst I fully appreciate the concerns around the mental health aspect of the trust, that I am advised at the upcoming health scrutiny meeting on the 8th of October that is on their forward plan for discussion and debate, and I probably would attend that myself, to be quite honest. Against the assurance of performance, again, without jumping ahead in the agenda this morning, but you will see in there the performance indicators on the current contract. I am advised that we have confidence that that's there, but also cutting to the points that Councillor Carr made around the splitting of lots, if you like. My personal preferred option is to keep it as one single integrated service, so there are no cracks, for the want of a better phrase, that anybody could fall through. But equally, that you can build through that procurement exercise, that robust structure in place. So actually, as representatives of the people of Nottinghamshire, that we can actually build something that we want, that effectively, for want of a better phrase, that we've got skin in the game with. So when something is not working, we're in that position to say, this is not working. What are you going to do to change that for the benefit of those that are accessing the service? Certainly, obviously, on the long-standing campaign around the face-to-face, absolutely, and understand from obviously the historical points in recent times around the pandemic and how that impacted the service, but to see that recovery back to where it is now continues to assure me that our current arrangements are working. But certainly, whilst we note the wider concerns of the Trust, Nottinghamshire Healthcare Foundation Trust, that equally it would be incumbent on me not just to sit here and throw bricks, but equally when a partner in Nottinghamshire is in trouble, that we use whatever influence we have as a council to help that remedy moving forward, but without the risk of blurring the responsibilities of select committee versus scrutiny. So I will pause there and I'll ask Louise and Helena to come in.
Thank you. So I'll pick up a couple of points and then hand over to Helena for a bit more detail. So thank you for your questions. So first of all, just to add in terms of contract and quality and performance assurance, so that applies to both the current contract extension that we've got for the 12 months and will apply to any service specification and contract going forward. So the learning that we've got from the... Sorry. Thank you. Is that better? So the learning that we've got from the last 12 months in terms of those additional contract quality and performance measures that are in our existing contract extension will be applied to the contract going forward. So whoever the provider is, because it's a competitive process and we don't know, whoever the provider is will be subject to those additional contract and quality performance measures. So they include, for example, things like increased service visits. So we've increased the schedule of service visits, increased frequency of contract review meetings, officer and member insight meetings, and again that invitation is open to anyone that would like to go and visit the current provider and any future providers. We've done some changes to the KPIs, and Helena will talk about KPIs and face-to-face visits. We've increased the qualitative indicators, so not just looking at those hard numbers, but also an increase in qualitative measures, an increase in the reporting of that quality schedule, and that includes looking much more regularly at safeguarding risk and incident reporting. So those measures are in place now and will be going forward regardless of the provider. In terms of your point about consultation, so that was so paragraph 14 is in reference particularly to the activity that's already taken place. So back in 23-24, when we first started this process, we underwent extensive consultation and engagement exercise with the public and with stakeholders, got hundreds of responses to that, and that has informed the development of the model, some of which is already being embedded. So the current provider are working really hard with us already to embed some of those changes, so things like the 3 to 4 month visit that will be new, that's added in. Other areas of transformation that underwent part of that consultation will take place in the new contract, so they'll be included in the specification going forward. We also made sure that we took into account any other relevant consultations, so working really closely with the early childhood service in the council and looking at their family hub consultations and other consultations that they've done. So all of that work has gone into to inform the model that will be part of the specification for all providers to bid for going forwards. And I guess that brings us to the next point around kind of partnership and integration. So we work really closely with the children's team here to ensure that the current service and any future service will be fully integrated. Recognising Councillor Carr's point as well around that 0 to 19 and not splitting things up. That's the now exact same age that family hubs we're working on, so we see that as real positive. The Healthy Families team are already, and again it will be included in the service spec, that they will have to be a core delivery partner of the Family Hubs networks process, and that works really well and linked into all of the early help system. The other thing that we'll be doing as part of the new service is setting up, name to be determined, but a partnership board. So when Councillor Carlton referenced that increase in shared governance, shared partnership, setting up a new board that will oversee the Healthy Families programme and really make sure we are doing that integration, not just with the NCC services where we think that's strong, but also making sure that's happening with our NHS services as well. I think it's mentioned within the options appraisal that the strengths of what we've currently got in an NHS provider does allow some of that integration with the NHS services really well. We've got to make sure that continues with whoever the new provider is, and again build that into the service specification, that they're a core part of our shared models and shared governance. Again, that links into the point around smaller organisations and how they can be involved. So when we're starting, there's a recommendation there that we'll be starting some pre-market engagement, so some soft market testing, before we go out to the market to kind of understand who's interested. So we'll be working on that end of September, beginning of October. Ahead of a cabinet decision. Doesn't take away the decisions that are available to cabinet, but just enables us to start things moving a little bit sooner. And one of the things we'd like to explore with potentially interested providers in there is things like consortia arrangements. So would they be interested in working with some smaller providers to look at elements of the contract, elements of the service where we could do things a little bit differently. Again, I think it's mentioned within the paper around what we've done previously and what we'd propose to do with the service going forward is make sure that it can transform as it goes on. So yes, it's a 5-year contract, it's shorter than the one that was proposed a couple of years ago, but things can still change within that timescale. So making sure that within that period we're able to transform, we can change if residents needs change or the service needs change, or the evidence tells us something different, and that could include continuing to work with different partners. So we'd see that as really key. So I think they were the main points that I was going to cover. I'll just hand over to Helena, if that's okay, Chair, to cover face-to-face visits and KPIs.
Okay, Helena. Yeah.
Brilliant. Thank you very much. Just to reiterate Councillor Carlton's assurance in relation to the face-to-face visits. So all of our health and development reviews and mandated reviews, so our new birth review, 6 to 8 weeks, 1 year and 2 to 2.5 years are delivered face-to-face routinely and as standard. We receive details in our reporting of those reviews and assurance that they are delivered face-to-face. And every quarter there are a handful that are not delivered face-to-face, and we receive exception reporting as to why that might have been. And predominantly that's our 2 to 2.5 year review, where parents are requesting specifically to have that review, not in a face-to-face way, but the absolute majority routinely delivered face-to-face. In terms of KPIs and monitoring of the contract, we have a really robust and quite lengthy performance management framework that sits around the contract, and that looks at activity across the 0 to 19 age range. So we look at the delivery of those mandated reviews and the delivery of reviews that are not mandated. So we have a 3-year targeted review, and we have reviews and activity across the school age children as well. We look at safeguarding activity. We look specifically at the support that the service provides for some of our vulnerable groups. So for example, teenage parents, and we look at things like use of evidence-based assessment tools and honoured referral. So quite a complex and robust framework which will carry forward into any new provider and continue to be monitored through the contract. Thank you.
Thank you. Yes, Councillor Doddy.
Thanks very much. Yeah, I think it's a lovely paper to read, and of course, giving every child the best start in life has been a core part of the Health and Wellbeing Board strategy since 2012, when Health and Wellbeing Boards were created. The importance of it can't be understated, and I think that in each and every opportunity, we're always trying to make sure that the children are most well looked after. If you look at 2022 and the integrated care service, and you look at how it was designed to go round in a circle, that mental health and at the hospitals and at the council all work together through a single unified budget to try and support each other and keep each other sort of as a unity, looking to help each other out in various different ways. I wonder if there's any possible domino effect or effect on the system as a whole by pulling out a £15 million contract from Nottinghamshire Trust, which is already £20 million overspent. What I see directly to me of an effect of this is that on Friday, PICS, the organisation that provides all the care in my surgery in the area around it, were notified by the Nottinghamshire Trust that they were pulling all the services back into Nottinghamshire Trust, atrial fibrillation, heart failure, palliative care, directly destabilising. What's a beautiful service at the present moment, and one in which I should be very keen to bring before health scrutiny at an urgent time. But is this a domino effect? Are we creating a degree of instability within the service through doing this? I think from my own point of view, when I hear the importance of Councillor Folan face-to-face, of course the origins of this was a man who didn't turn up to his outpatient appointment, who was severely mentally impaired and was discharged back into the services because he didn't turn up, not knowing that the fact that somebody doesn't turn up who's mentally unstable is an indicator that they're even more unstable than they were beforehand. If the Nottinghamshire Healthcare Trust implemented that same service with paediatric care and face-to-face, we would have many children being discharged because they didn't turn up to their various checks. In children, we don't call it a did not attend, we call it was not brought, because a child doesn't have the ability to do that. So it's very, very important that the very core reason that we're discussing this was a failure to follow up on somebody who didn't turn up. And of course, that would be so crucial to the development of proper care through this programme interested to see what is the domino effect that we create by taking a tender off somebody. I've already seen the effect in my area where PICS, a small provider organisation that we want to encourage to do that, are already seeing a contract for 20 of their employees being pulled back in. And if you are overspent and you're pulling contracts back in, the only reason to do that is to save money. And are we saving money at the risk of poorer care? If it was up to me, I would bring it back in-house, as Councillor Carr suggested. That would be the holy grail of it. But if it isn't that, I would like to see it go to a single, complete tender and not be fragmented, as fragmentation ends with poor coordination between the various things. But that's enough for me, Chairman.
Well, let's see what Councillor Carlton's department's got to say about that.
Sorry, excuse me. Thank you, Chairman, and thank you, Councillor Doddy, for your variety of questions. I will briefly answer, and I'll ask the Interim Director of Public Health to step in. As it's been acknowledged already through this very deep and thorough process, that one common denominator is not on our side, and that is time. Obviously, time in the sense of we cannot continue with the rolling 1 year extensions, which I equally don't think sends the right message around trust and confidence. But then equally around the wider thought, if you like, of probably where it was 18 months ago. Part of that debate around, was it right to bring it in-house? Is the council best placed to deliver that? Equally, some of that could be influenced, if you like, around some of the wider concerns around the trust as our current provider, again without sort of prejudging final outcomes of the process once it gets underway. But equally, I think that we do have a good standing in Nottinghamshire across a wide range of agencies, if you like, and going back to my earlier comments, again without sort of prejudging final outcomes, that particularly when one of those key partners is in trouble in the current times, not necessarily in the remit of this and what we're debating this morning, so that we do have that ability to lean in. That when we look at the situation around Nottinghamshire Police, it was very easy to be very insular, draw that drawbridge, if you like, where actually if we could work together to deliver these sorts of things moving forward, that would be the ideal. But I'll allow Viv to come in.
Thank you, Councillor Carlton. So thank you for your questions, Councillor Doddy. I think you raised some really valid points and some things that we absolutely have acknowledged and really thought about in terms of when we've looked through the options appraisal. I think one of the things that I would assure, and I'll come into a little bit more detail in the performance report, is at the moment we do have a good and strong Healthy Families programme, and we have confidence in that element of the service. And as Councillor Carlton has mentioned, the broader organisational discussion we will support in terms of that house scrutiny conversation later on in October. What we have provided here is a really detailed options appraisal around the levers that we have got to our hand at the moment. So from where we were a year or so ago, there have been changes in terms of some of the procurement regimes. So some of those options that we may have looked at before are not there. So we have to look at that differently. And also the landscape around us has changed, and we absolutely need to reflect and respond to that. Having said that, that does mean that the option that we are presenting at the moment, so that open procurement to a single service, all age, does provide us some opportunities. It provides us some opportunities to really look at the whole market, so not just necessarily the providers that we know, to make sure that we are ensuring that we are utilising all the levers in terms of that innovation, that quality, those performance and contract indicators that my colleagues have just demonstrated there. But it does also make us think around how we can make sure that we are utilising all of our procurement options. So one thing that we are talking about here is how we procure the service, not what the actual service is being delivered. And I think with any change, there is potentially some change to work through, but hopefully that we will maintain a depending on the provider and understanding around how we mobilise that service, we would hope to maintain a significant proportion of the staff that are delivering that high quality service, because many of those staff will 2P across to whoever the potential provider will be. And I think looking at the option that we will have, they gives us levers within the procurement approach to have those conversations, do that soft market testing, see who is available, and get assurance around some of those risks that you mentioned there. Because actually what we do want is a really holistic and integrated service that will continue to grow from strength to strength. So I think acknowledging that with any change that there is risk, but I think having reassurance around the really thorough process that we've come to date, and confidence in the team around how strong that procurement process but then mobilisation will be, because that will help us embed a really strong and sustainable service moving forward. Thank you.
Thanks very much.
Thank you. Anything else? Do any of the other officers wish to add? Yeah, Louise.
Thank you. I was just going to add a final point on the face-to-face visits in reference to your query about safeguarding. So as Helena talked through, it's a really small handful of parents who don't take up that face-to-face offer, but each one of those is followed up by the Healthy Families team to find out what the reasons are for that. So most commonly, not in all cases, that might be things like it's the 2 to 2.5 year review, child's in full-time childcare already, the nursery or the childcare provider has done their assessment, said they've got no concerns, parents got no concerns, parents is working full-time and says, I really can't make that visit, I'll have a conversation with you over the phone and everything's okay. That might be one example. If there's examples where the team can't get hold of them, they will keep trying. They don't just take one incident of child wasn't bought and accept that. They keep going and going until they're able to have a conversation with the parents. So just to assure you there around that safeguarding element, we're confident there are audits that happen on an ongoing basis with the current provider, and again that would be continued into whoever the new provider was going forward, to make sure that we're assured that is happening. Thank you.
Thank you. So, Councillor Pringle, would you like to comment?
Thank you, Chair. Firstly, allow me to continue Councillor Carlton's appraisal of Councillor Henshaw's daughter in two goals, but also highlight the fact that she also created Paralympic best times during that as well. So she really has been a special athlete for Mansfield. And I know we've got Nottinghamshire investment as well. To the paper that's in front of us, it's probably the best detailed paper that I've read for many a time, and thanks to Viv and Louise who run me through it previously, and the guidance and options on that report that we had personally was taken on board and discussed, as obviously you'll be aware from the questions that's been asking. But I think the way that you've responded today to the questions has been really positive. I don't always agree with everything that's been said, and I think there's issues in and around that. But I think, Scott, you must be really pleased to have the sort of backing within this, to be honest, because both all officers are very detailed in what they can offer in respect to the questions that's been raised. Really, really positive to it. I think Steve brought it up, the 0 to 19. That charter in itself, the Sure Start issue that we change, and that's gone and we change it, that has to be a priority, because the continuity that offers, it's not for us, it's for those people that seek it, is vital. And the older they get, the more vital it becomes, as we recognise that. The 3 + 2 years, again, that offers stability. Rather than Scott, you brought up the 1 year extensions. That's a failing, and we all support the 3 + 2 years as an investment, on the understanding that the governance of this is still within our capability to question and raise questions and bring back to committee so that we can raise issues, because we'll get different things from the streets brought back to us as individual members that we can feed through to you that don't necessarily come through to you. So that should strengthen a positive new structure, which I'm really supportive of. The face-to-face is really, really important, and I know you said that there's a continuation of Louise, and
Helena, you brought that up as well. It's going to be really important that we see the figures that aren't contacted, so we acknowledge that and support each other and moving this forward to make sure there are nobody that isn't contacted and that we can do that in some way. The consortium working ticks every box from me. I love the idea of bringing it in-house, John. Love the idea. I think we're outside of that scope with this paper as it is presently. But just because somebody's a small enterprise doesn't mean they have serious powers in being able to offer something and suggestions that we can all work together and develop and make what's in front of us stronger. So I don't very often praise officers for delivering papers like we've had today, but I'm going to do it again. This is probably one of the best papers that I've read. So thank you. Thank you, Chairman, for allowing me to speak.
Thank you, Councillor Pringle. I think I don't think there's a question in there. I think
Several. That's just me waffling on, Chair.
Thank you, Councillor Pringle. You beat me to in your closing remarks around waffle, but no, I mean, absolutely sincerely, I actually completely agree with you. I thank you for your comments this morning. It might be my name on the report, and I bear the responsibility, but certainly over this last 18 months or so, I think the best word I could use to describe has been very much a journey. A journey through the scrutiny process, obviously for the external factors that we've mentioned this morning, to where we are now. So I am incredibly grateful to Helena, and the wider team, because trust me, in the briefings that I've seen, had one-to-one with officers, there's been a hell of a lot of work going into this in a very short time scale. That has to be absolutely commended. But certainly moving forward, the biggest thing for me is having that ability with whatever procurement exercise and where we land with a provider, that we do have that ability to influence. So around that sort of corporate governance, that's one of the key points for me. Whether it sits in the house of the council or in sort of with an external provider, having that ability to pull levers to influence outcomes for us, using that evidence-based approach through sort of the public health data, involving the voice of those that do interact with those services as well. So clearly a long way to go. I'm immensely proud of the work that's gone into this, and I don't know if anyone else has got anything to add.
Just want to say thank you for all of your comments. All of the comments have really helped shape the journey that we have gone on, and the team, Louise and Helena, but also Catherine, who I know is watching as well, have been really instrumental in terms of pulling this options appraisal together, and we're really keen to think around how we build on this approach and really make sure we have that transparent conversation as we continue through the journey, but really making sure that our children and families are at the centre of what we do here, and really utilising this opportunity. And I think there is something around, we've got a 5-year contract, a 3+2 year contract to think around where we are now, but that does give us further opportunities to keep thinking and keep growing the service, and we will make sure that transformation and that integration and that further improvement is something that we will continue to bring you evidence on, and allow to have further conversations as part of the performance reporting for the wider public health outcomes, and we will specifically look at how we can link some of that more data around those face-to-face contacts, so that you're seeing that much more openly and transparently moving forward. But thank you for your comments and support.
thank you very much, Councillor Kerry.
Yes, thank you, Mr. Chairman. Concur with much of what has been said already. I just wanted to emphasise the importance of the feedback from the service user families. It's not about just having face-to-face. It's about what ensues from that contact and to see whether service improvements can be found. So it's really asking how do you do that, and how do you escalate so you understand really what those opportunities are.
Thank you. So when I talked about the contact review meetings, so they've been increased in their frequency. that's exactly where that feedback would come in. So whether that's from complaints, compliments, from the service user feedback that is written into the spec that the trust have to do on an ongoing basis, or whether that's sort of external consultational engagement work that we've done. So, for example, last year we held Baby Week, and this year we're doing the same thing in November. So an opportunity for us to talk to parents and families out there in Nottinghamshire and get all those feedback, and then have a conversation again in those contract review meetings, which are increased in frequency with the current provider, to say, and how are you acting on that? What have you done? So this is what you were told by service users. What have you done? And again, that will be enhanced in the contract for the next 12-month extension, and we'll use that learning in the spec going forward. Thank you.
Thank you. Councillor Carr.
Yes, thank you. Just an observation on something, what everybody said, and I think this has been a brilliant discussion. I think, Scott, you mentioned that it's not ideal for us to keep renewing the contract as it is at the moment. However, if we do go for option 1A or option 3, I think that the amount of work that we'll need doing for option 3 will probably mean that we may have to actually extend it, but I don't think that should put us off on getting a fantastic in-house service. And of course, the other thing is this runs out, the contract runs out in September 25, and 4 months before that, something's going to happen here. And the joy of the British political system is that if there is a change of who runs the council, the officers will be exactly the same. And so it can continue. But I don't, as I said, I don't think we should rule out extending the present contract. Obviously, I don't think we can discuss that here today because it will probably be an exempt report because of personnel ramifications. But as I said, I don't think we should rule it out because we may have to extend the present contract for a further period.
Do you wish to come back on that?
Yes, thank you, Chairman. Thank you, Councillor Carr, for your comments and questions. In short, around my remarks of not sort of rolling forward, if you like, is that from a legal advice point of view, under new procurement legislation rules, we can no longer do that. So this is where I sort of use the phrase of time is not on our side. That's not to say that we make rash decisions. Clearly, as you quite rightly evidence, that there's a substantial amount of work in the timescales given. I think it would also be, obviously, as you referenced, the sort of the political elections next May. That equally, one of the risks, sort of even in the current arrangements that we have, is any response that the government may wish to take to Nottinghamshire Healthcare Foundation Trust at this given time. So there's another sort of dynamic there that, you know, the team from a Healthy Families point of view is sort of really keeping a finger on the pulse.
Thank you very much. So I think I've got no more speakers, but I'm going to come back to you, Councillor Carlton, and your officers. You've had some high quality debate and feedback here. Is there anything else you'd like, any feedback on this particular issue? Well, you've got the opportunity, you've got the councillors here. Is there a question, or is there something that you need more build upon?
No, I was going to say I'm actually really heartened with the debate comments from all sides made this morning. Raft of opinions and options that I know the team and myself have been scribbling down like mad. But I think I'll also go back to a point that Councillor Pringle made in terms of the briefings outside of committee for various groups or members that are interested. From a committee point of view, obviously that has been sort of carried under my instruction, if you like, and moving forward. Certainly whilst I sit in this chair, I'm more than happy to carry on that conversation.
So I'll hand over to Martin now to read any areas of further consideration and any issues that he's pulled out of this.
Yeah, I think you've covered everything. I think you've definitely covered what was in the recommendations. It's just a question. Obviously, we have got the work programme set for you, and we haven't got this item on again. So it's really just asking how you'd like to be kept up to date with the actual of the process, and whether you'd like to perhaps receive some like written briefings as the stages go on, as the cabinet member makes their decisions, just so you know what's getting on. And then if there is something you'd want to then bring back to committee that would help you make those decisions. So is that something that members would like?
Yeah, Councillor Pringle.
Yeah, I think on this subject in particular, the committee generally has got full confidence in what Councillor Carlton's promoted to us through any written detailing it, and I understand from what we've just discussed, if there's anything else that wants raising, Councillor Carlton's open to raising it with us prior to a decision being made or to inform us, which is what we had before. So I'm happy to leave it in the hands of Councillor Carlton on the assumption that we do get these up-to-date briefings. Thank you.
Yeah. So that's great. Sorry, Councillor.
I was just going to say that just to come back to the point of the domino effect, I'm still curious as to what the fallout from Nottinghamshire Healthcare Trust not getting the repurement of this contract under overspend, under budgeting, and on the other services that they're pulling in-house that are affecting other parts of the county. Just, Martin, if we could somehow get some idea as to consequences of the action over the ICS, because we are one system and therefore it's like Jenga blocks. You can only pull out so many.
That'll only be necessary if they don't go for the renewal, won't it?
Sorry?
If they go for the renewal, one of the renewals that's been suggested, your concerns with the domino effect will not occur.
Only if you renew it with Nottinghamshire Healthcare Trust. But if you renew it with any other party, then that is a budget of
and
15.
we're with Nottinghamshire Healthcare Trust at the moment. Yeah.
Yes, but
Yeah.
we're going to
Just checking with them.
because it's a single system, and therefore, if you take something out of it, something else has to be affected by it.
Thank you, Councillor Dolly, and thank you, Chair. So I think there are a range of procurements and changes to service delivery and provision that are going on across Nottinghamshire all the time. And I think we need to make sure that we're not seeing this particular procurement in isolation to a range of other things that are going on across the system. I think one of the things that I do think we need to think around, and it builds onto Councillor Carlton's point around how are we supporting our partners across the system, where we know that many of our partners are would benefit from our support, and I think there is something around acknowledging the positions of a range of partners and how they impact on each other. So there's certainly conversations going on across with the directors of public health in terms of really understanding where those pinch points are, I suppose, and what the implications would be on the population's health and well-being. So I suppose is to provide assurance that in the background that the DPHs and the public health teams are having those conversations around what do these changes here from the ICB mean, what does this mean from NUH, what does this mean for Nottinghamshire Healthcare Trust. All of those conversations are going on. I suppose there is something to think around though, if we're wanting to have reassurance and understanding around that, if that's something that we might want to consider in terms of some of those broader health scrutiny conversations, because that's where we can bring the partners and the commissioners into the forum, so that you can make sure that you're getting discussions from all partners and you're getting that reassurance that you need. So I didn't know whether that was something to consider for
Thank
that.
you. Does that satisfy you?
No, it's brilliant, but as you said, it's happening in lots of other areas, and not just this particular one. Our main concern is our families and our residents are necessary.
Thank you. Councillor Trevor.
Yeah, thank you, Mr. Chairman. I don't have a question as such, just felt it right to comment. As Chairman of the Children and Families Scrutiny Committee, I'd just like to thank you for the invitation to myself and to committee members for today. The one thing that I would be cautious of is the issues around, if you were to make any changes, then you have made comment in the SWOT analysis about workforce attrition. So that was probably the biggest area for me, which would be a concern. But you've commented on that in some detail. But my only comment would be, don't underestimate the power of the impact of moving services in terms of workforce attrition. Okay, thank you very much.
Thank you. Councillor Paul.
Yeah, just thank you. I mean, I do understand what you're saying here, Councillor Doddy, and I do realise that actually this is a hugely complex and very large kind of contract that needs an awful lot of kind of time and effort to go into a whole range of different things. But I think what's really important here, and it's going to sound a bit simplistic, I'm sure, is that we need to get the absolutely best service to serve our residents the best, don't we? And that's got to be our core. And if that means moving, and I'm not preempting, I've no idea, but if that means moving from one organisation to another, then we've really got to do it, do the risk assessment, and do the very best we can to make sure, as you say, that our service users don't suffer. Because we've got to do the best for our people here, haven't we? Really, and I think that's got to be override kind of everything else, really, that we do. Thank you.
So that's a comment rather than a question. So we'll go to, we note that the did, and we'll take the vote on a show of hands. All those in favour, please. Yeah, that's kind of, yeah. For the competent performance. Item 5, Adult Social Care Performance, Risks and Financial Position, Q1 2024-25. I ask Councillor Jonathan Wheeler, Cabinet Member for Adult and Social Care, to introduce this report.
Thank you, Chairman. Good morning, everyone. So, hope you remember back in June, I came to present the Q4 23-24 performance and risks. So, back again with Q1 24-25. So, hopefully everyone's aware the performance indicators being set out are against our local accounts. I know last time we had a presentation and heard from some of our carers, which I think was really important to do so. Today, you've got the financial position as appeared for 24-25, and obviously our key department risk at the moment. As hopefully everyone has seen, it's quite a detailed report. We also put as much detail as we can for yourselves to obviously come and ask questions and for yourself to hopefully give you some reassurances. So I'm joined today by Guy, who is the Interim Director of Adult Services, who is covering Mel when she's away on her ADAS role. So welcome to Guy, and with your leave, Chairman, I will take us through the report, and myself and the team are here to answer questions afterwards.
Thank you, Councillor Wheeler. So we'll take the report, please. Yeah, add to the report.
Thank you, Chairman. Hello, everyone. I'm Guy van Dickler, as Jonathan said, standing in for Mel today. The report is in a number of sections. One is around the local account, which has 6 priorities that were co-produced with people, and also led by the big conversation that was held back in 2023. We also go through the vital signs, the departmental risks, and also the financial position at the end. I just will assume that you've read the report, but I just want to highlight a number of things in each of the themes. So, in terms of making it real in theme 1, the strength-based approach is really important to what we're doing. I think the progress that has been made internally has been great. I think we're now moving towards how we do that with our contracted services as well. So with the providers who are delivering some of the services, and we start to have some good responses from them to embrace this strength-based approach. I also think just some of the indicators, people who are receiving long-term support and care is green, which is good to be noted. And the number of adults aged 65 and over supported in residential and nursing placements is amber, but is in the right direction. So it is our ambition to ensure that people are exploring options other than residential or nursing care where possible, and is best meeting their needs. In terms of making it real, theme 2, the information and advice. I know you had an item on the carers strategy last time, with some real positives there, with 17% reduction in carers needing a full assessment due to better advice, which is great. And there's also some improvements in how we do videos and sign language videos for people in the deaf community, which should also be noted. I mean, I wanted to say in this that last week I chaired the Making It Real forum for Mel, and actually the residents who are part of that and co-chair it were really pleased with what was going on in their progress. They felt it was, they were able to say that real progress had been made. So that was really nice feedback from them, and I'm sure you'll hear that in in other arenas from them themselves. In the Making It Real theme 3, the active and supported communities, I think this is a good news story that we're supporting people into access education, employment and training or volunteering. So again, we want to be ambitious about that and continue to ensure that people have those opportunities. In terms of theme 4, the flexible and integrated care and support, I think the area that we want to do better on is the improving the reviews, making sure that we are doing strength-based reviews, but also making sure that everybody who is in receipt of care does get a review. I think sometimes it should be noted though that sometimes some people have 3 or 4 reviews a year rather than just one. That's because of changing needs, etc. So, I mean, that does put demand on the review capacity that we've got for people, but nevertheless is important, and our ambition is still to make sure that everybody does have a review so that the care that they receive is the right care and support. And also the proportion of adults receiving direct payments is a measure that is amber and something that we are looking at to move to green, but this is also dependent on a number of other things. It's also people wanting to be able to take a direct payment and manage the care themselves, but it's also making sure the market is there for people to be able to purchase them themselves as well, which is simpler in some areas. So if they want to purchase their own domiciliary care, etc. But if it's more specialist, then that can be more difficult, really. Against theme 5, we are recognising that there are things that we need to change. We want to be more agile, more accessible, and more flexible in our resources, able to be both increase demand, but also accommodate changes that happen in the environment around us as well. So that means that we have moved to sort of a more responsive service where we are bringing teams together so that it's an all-age service going forward, and some development work with the teams is currently underway in that area. It's good to show that the hospital discharge, though, which is a key performance area for us, is green, and also that the reablement work that people get coming out of hospital is excellent and has been doing really well for people who then don't need an ongoing support from us. And then in relation to the workforce, we have got some developments in relation to continually wanting to increase people who want to come into social care. So we've got the Workforce Academy taking off. And we also know that there are some hard to reach groups in our workforce. So whether it be the adult mental health practitioners or the best interest assessors, we continue to do a lot of work to try and increase those within the workforce. But retention overall is good in Nottingham for its workforce, which is a positive. And that's all I was going to say on this phase in relation to the local account. Do you want to pause there before I go on to vital signs, Chairman?
So, have we any questions on these figures? Oh, Councillor Pringle, sorry.
Thank you, Chair. Thank you, Guy. There's a couple of things which I'm sure you'll be able to answer pretty quickly, because I think you've skirted across some of them anyway. But just because I'm a layman and I don't really understand percentages, 3 out of the 7 performance measures are below the standard of where we are, but I don't know what standard that is. Even those that are good, I don't know what figures they are, so I can't compare them next time you come to us. So I'd like to see something clear on there with regards to figures rather than percentages. Even if you're going to use percentages in the tables, then something within the guidelines, so I understand how many people it is. I think the one thing we talked about is 12 people in 12 months in receipt of services. That sort of thing I can relate to. I've worked in finance too long to know how to use percentages. One concern is very much, or 2 concerns. Score improving, again, same figures as to what? Is that improving by 1? Because yeah, it is, but I can't relate to anything to it. I'm not knocking this, it's just detail I would like. And also AO2, the very high. On page 94, score worsening. A little bit more detail as to how we're going to get over that, because that's something, if we're talking about the additional team performance, I'm assuming that's a long-term thing, so that might take a little bit of time. My last question, Chair, is paragraph 34, which again indicates an overspend of 9.64 billion at Q3. I'm assuming that we've seen that coming. I would imagine we've seen that coming, and what plans are putting in place to correct that. Thank you.
Thank you, Councillor Pringle. Mr. Dishall would like to respond. Sorry, Councillor Wheeler, you want to go first? Yeah.
Well, thanks, Mike, for the question. I mean, if I take the last one first around finance, yeah, unfortunately, we obviously have seen that coming in terms of the predicted overspend. Obviously, with the increased demand we've seen in the year, which I'm going to talk about last meeting, which it's very much difficult for us to take that demand and to obviously move quickly to say we can, with our in-year budget that's been discussed previously, to say we can absolutely meet that straight away. But what the assurance I give you is we are constantly reviewing it. So I'm having, as you can imagine, constant meetings with the finance team, with the directors to go through it, and we take every step we can to mitigate the overspend to get down as close as possible. Obviously, it's difficult because we're not talking about, you might have other before, we can say we're just not going to resurface that road, we're just going to close this, close that. That's not something we can do for obvious reasons. But what we can do is keep reviewing the package delivery, make sure they are right for the resident, but also they're the right value. I think the work we're doing in terms of our brokerage and in terms of reviewing the system we have in place, we'll see that big long-term impact, and obviously the technology-enabled care. So to get that reassurance, it is constantly on my radar. Our regular meetings to go through it, and we've got a finance team who are constantly crunching the numbers to make sure we bring that down as much as possible. So it's obviously not a position we want to be in, but at the same time, we're also trying to balance out with the fact that we need to deliver that care to people. So we want to make sure we're still doing that, but in a way that's obviously the most cost-effective for authority, but also bear in mind that it's people's care we're talking about at the end of the day. In terms of the comments you make about the report, absolutely take that away. We'll take that to make sure we get the right figures you want there in terms of just percentages. Again, sometimes it's death by spreadsheet or death by percentages, isn't it? So we absolutely understand it's to give the numbers behind it. So absolutely, we'll take that away and bring Guy now, if that's okay.
Thank you, Councillor Wheeler. Mr. Dishall, do you want to expand on that?
Yeah, thank you for the question. I think that it's really important that you do understand the numbers as well as percentages, because actually sometimes it can be 2 or 3 people and sometimes it can be hundreds of people. So I think it is important to understand that. In terms of the benchmarking and the data, we don't make up our own figures, if you like, really. We are benchmarked both at a comparative group of similar authorities, but also on a national level. So we have to do a return on all our data through something what's called ASCOF, which is the Adult Social Care Outcomes Framework, and we're nationally benchmarked against all of those. So what you'll see in here is some of the national ones where we are benchmarked against other people. And then the only other return that we have to do is also around safeguarding. So we have to do a return on our safeguarding, and that comes out in a national figures against how we're comparing to others as well. So, but I get your point about the numbers of people. We can do that, and it would be really helpful to just put in brackets where that is. Yeah.
Yeah, really quickly, thank you for that. And when the national, whatever you said it was, NASCOF or something, I didn't pick that up in the papers. Can you tell me what that is? Because if I've missed it, I'm really sorry.
It's a national framework that every council has. It's called the Adult Social Care Framework. It's the returns that we have to do, and what we do is break it down into this. So we call it the local account. We've got a number of figures that we have in here. That's so it's recognisable and more explainable to people who have been involved in that. But actually, there's a big piece of work behind it that is the ASCOF framework, which has all our data in it, and that has to get sent off to the Department of Health for us to compare with every other authority in the country.
So if I can, because I wanted to go on that. Yeah, again, if it's not in the paper, I don't know that. So that's the sort of detail that I'll be looking at to be able to understand the percentages, even though I don't like percentages from that. When I'm talking about 9.64 million, I know how much money goes into this adult social care, and really in comparison it's small figures, but it's £10 million at the end of the day that we should be aware of, and what moving forward, that's all I'm just going to do. Thank you, Chair.
Councillor Pringle, thank you, Mr. Dishall. Councillor Carr.
Yeah, thank you, Chair. Members will all know that we've been dealing with a massive challenge in adult social care for both as a county and as a country for many, many years. I think the last government that seriously tried to tackle this was the coalition government from 2010 to 2015, but that all collapsed. And I'm just concerned that that we're going to be making the same mistakes all over again. I'm concerned that the new Chancellor has now said that she won't cap costs for older people's care, and Stephen Kinnett, the Care Minister, has said that he's minded to scrap a fund giving training to £37,000 care workers who we're desperately short of. We've been, as a country, working with 1,000 vacancies in the care sector for many years now, no matter what government's been in power. And I just think that we need to somehow be grasping the nettle. I fully appreciate the dilemma that the new government faces, but this is an issue that's not going to go away, and it's something that as a council we're not going to be able to deal with without government help. So I would actually ask, have you had any communications at all with the new government about their intentions to actually fund this gap that we've got? And it's not just a financial issue, it's a social issue as well. You know, we're relying on unpaid care workers, many of whom could go to work and could be productive, but are actually subjected to levels of poverty that they wouldn't be in if they were working, because they're having to look after somebody. That I'm an advocate for. The government money should be helping these people and not relying on people having to give up their livelihoods to look after people. Thank you.
Thank you, Councillor Carr. Councillor Wheeler.
Yeah, thank you, Councillor Carr, for the question. I mean, in terms of the discussion with government, we are thankfully quite unique in the fact we've got Mel in her role as President of ADAS, so she's having regular conversation with the Department of Social Care, and I've been chatting to her about feeding information through rather than both doing it separately. It makes no sense. We want to make sure we put it directly to it. So Mel is having those conversations with the department and with the ministers as well. I think you're quite right where adult social care needs to be front and foremost in my view. I think we hear a lot about the NHS, and rightly so, but adult social care is, I would say, that's obviously just as important for that conversation, especially with we know with the aging population where we're going to be in 10, 15 years time, that demand's only going up, it's not going down. So it has to have an honest conversation, I think, cross-party, for me, I'll be honest, to have that, to do it, because you're right, so far, in terms of seeing what's been pushed back and delayed to the social care reforms, it is a certain moment for us to plan. And obviously we've got the legislation for the social care precept levy is actually supposed to expire this year, I believe, so we need to know what the new government are going to do. Is that going to be renewed? Is it going to be changed? So we know what money we've got for next year, which, again, for budget-wise, that's hard to plan. The budget team, the finance team is doing the best, but they're going off current assumptions. So you're quite right. We need to get that information. I think, and what Councillor Pringle said at the end of his word in terms of the overspend, we do know it's a lot of money, and that's why we're doing our best to mitigate. At the same time, as I've already said, the issue is we still need to provide that care, and obviously the demand we saw this year was way above what we forecast. Just on the demands coming through, and obviously we're getting a lot more complex issues, especially with some of the NHS backlog clearing. Obviously, post-COVID, that's then having that knock-on impact onto us. So our team's doing a fantastic job in dealing with that. But as you say, we are reliant on the government in terms of giving us a clear direction on how they see social care going over the term of finance, and then we can obviously adequately plan and make sure that we deliver what we need for our residents.
Thank you, Councillor Wheeler. Any other comments? Yes, Councillor Doddy.
Just an observation, really, in terms of I see the small figures around weight loss of 243 people at 5% weight loss, etc., etc. And just that in the world we live in, the commonest thing that I get now is somebody coming in and asking me about Wegovy or Ozempic that everybody's talking about, and this will influence the weight management challenges of public health for years to come. The answer will not be in diet and exercise, it will be in great pharmaceutical developments like we did with COVID, and soon that will become available around the world to influence things. Just to put it in context, if you started with Govey in the morning, it cost you £150 to buy online, which is £5 a day, which is a cappuccino. That's what I say to people. If you get a cappuccino in a newspaper and you don't get them, that's the cost of giving yourself Wegovy for a month. It's not a big thing. Have you noticed much of that through public health, or have you had any feedback, or are you getting any sense of the changes that are occurring in how people are managing their own weight to going straight online and buying Wegovy?
I'm just going to hand over to the
Yeah,
interim director.
Councillor Carlton's going to answer it. I think he's going to attempt to answer it.
However, the only part of my was going to say, have you skipped forward in the agenda? So obviously they're currently doing the adult social care, or is it a specific question within that paper?
Not an observation of how weight is sort of affecting things.
So we can pick up in terms of some of the performance of the integrated wellbeing service when we come to public health performance, because they're two separate reports now. So we can pick up some of that there. So do you want me to cover this now, Chair, or do you want me to pick it up when we go through that?
It's in the next paper.
It's in the next.
Yeah, can we pick it up in the next paper?
The next paper.
Yeah. Right. So we've got Councillor Fowl, I think.
Yeah, thank you. I mean, the point is well made that the new government is in an awful kind of situation financially. I think we all recognise that, don't we? And they've not been in power all that long. But certainly, I think everything we can do to lobby the government to explain the kind of difficulties that we're having in local government. It's not just adult social care either; it's a whole range of things. And certainly, I'd be very happy to join in that. And we're doing it all the while as Labour members too. So just to reassure you of that. Just my specific question is and again, it's leading on, I think, from what Councillor Pringle was saying. Under paragraph 26, there's a table there that says it is the percentage residential adult social care providers really good or outstanding by the Care Quality Commission. It's 70%, and that is actually rated as green, and it's actually gone down significantly, which means 30% are not. And I raise this particularly because I have had two particularly quite difficult incidents kind of just in my division around this, where some residential homes have actually kind of got into real difficulty. And whereas I think most of us in this chamber members will say that most of the stuff that comes off the doorstep might be about roads and potholes and all the rest of it, social care is coming up more now, I'm finding, on the doorstep, and I think it's something that actually is impacting on more and more people. So it'd be really interested to know why 70% is considered to be green. I suppose that's the question.
Yeah, what I would say is you will never be 100%, because actually 100% of providers providing care that are registered with CQC will all be going through a transition period. So either they'll have new providers that have not been registered yet that won't have a rating, or you'll have people coming off, or you'll have people who are changing registration requirements. So you'll never be 100%. You could see, if we wanted to push it to 8%, for example, what would that look like as a marketplace? And we can do that work behind the scenes. But I think we're also better than a lot of other areas as well. So that's the green bit of it. When we do our comparison to other areas, we're looking green compared to others.
But briefly, but that still means that 30% of registered adult care providers, we have some of our service users or some older people in there not getting the best service they can, and that's my concern. And it might be good compared to other providers, but we're talking about Nottinghamshire here, aren't we?
It won't necessarily mean that 30% are with a bad or poor provider. They may not have had their registration and therefore then be had their inspection. So actually, it's not as high. 30% is not poor. That's about it.
Matt Pringle's point, doesn't it? We need a bit more of a kind of understanding around the numbers, doesn't it? So thank you.
So I think that's resolved. Councillor Wheeler, you wish to come back?
Yeah, it's really important to raise that. I think also just to give you that reassurance that our teams are constantly working with all our care home providers. So we are in there, on a daily, weekly basis to chat to all providers to make sure that care is good, not just relying on CQC to the inspections, and we are constantly working with them because you're right, we want to make sure everyone has that good quality care. We are reliant on the providers to deliver that, but when they are not, we do take action, as we have done in terms of taking people out of care homes if we don't feel their care is appropriate. and obviously having the constant conversation we do with providers and CQC. So just give that reassurance. We're not just absolutely want to be at 100% we can. That is, as guys set out so in terms of the based on the official rating, so to speak. But every care home, everywhere we've got people in, we are constantly working and reviewing ourselves to make sure that quality of care is where we expect it to be.
Thank you. Councillor Wheeler, Mr. Diesel.
Just to add to that, I mean, I would encourage everybody who comes into contact with people who are in receipt of care, if they're not happy with their care, to promote that they do talk to the provider or talk to us if that's happening, because we will pick those things up.
Thank you very much. Councillor Martin.
Yeah, on the last point, I have got a resident who's not, well, they are happy with the care, but the conflicting statement is coming from the officers dealing with the case, you know what I mean? So he went to Poppy Fields and was assessed that he needed to be in a nursing home, and now social workers are saying you don't need to be in a care room, when clearly he does. So anyway, I have pointed it in the right direction. But my question is about AO3 on page 93. People waiting for a conversation about their needs with an allocated worker. Is this high because we have the inability to employ enough staff to ask these questions, or is it just simple volume? Because obviously this particular cohort of people will exacerbate the financial problem because of what it actually is, and it worries me because of the Nottinghamshire Healthcare Trust issues that we've had, that this is not a priority, because, or is that based on your ASCOF?
Thanks.
So we do take account of everybody who's made contact with us who needs something, that we make sure that we've had a conversation with them in the first instance. Sometimes they will then need a further assessment and are waiting for some of those things. And that can be a range of things, between waiting for their assessment, waiting for the care that they need through their assessment, or they've been on a waiting list that we consider not to be urgent. So some people will make a requirement that they don't need for a few months. So they've either got an appointment or they need some respite or whatever it is. So there are occasions when people want to be ahead of the game, but they're on a waiting list as far as we're concerned, really. I think we have got higher demand, but that's, everywhere. Everyone's got higher demand. We have a priority way of working with that, so people get prioritised in terms of everything that's needed on the day will get done in the day. Everything then gets prioritised to 1, 2, and 3, and also lots of circumstances change. So quite often people will be a priority that day because they're coming out of hospital, but actually something's changed. The clinician said they're not ready for discharge, etc. All of those things will factor into whether people are waiting for care or not. I would say as well, with the national framework in terms of what we measure as waiting has just changed, and next week we're going to go through what the new guidance is as officers, to understand how that will change and how that will affect our figures, really. So but we did go through performance board last week, all the numbers of people who were waiting, what categories they fall into, and making sure, because from our perspective we want to make sure that people are safe, and so actually we will make sure that everybody is safe as a priority, really. So I don't think, there will always be some people waiting. I don't really think it's a staffing issue. I think once we get to that stage we would come and say that we've got a problem with the staffing, but we're quite well staffed in terms of what we're delivering on.
Thank you. Councillor Fielding.
It was a question I was going to ask was very similar to what Councillor Martin's just asked. We've got a lot of very high risk on what is departmental risk. What effect is this continuing pressure having on our staff and their well-being? Because I say staff well-being is hugely important for the delivery of adult social care and across the whole of council, and also on the point that Councillor Martin raised, on that section it talks about dashboards being what progress has been made of that, and how is that going to help them mitigate against the issue? Thank you.
Okay, sorry, if I just come in first, Chairman. I know it's guys talk about the dashboard. So, your point, I think it's absolutely right. So about our teams. So myself and Tom I've been out all summer talking to our teams, and they're just last week chatting to 30-40 of our social care workers. I think what's really important that all our teams do, our managers coming all the way down from Guy and the senior directors, is the conversation with people on a regular basis, and that's what's happening. So we're communicating. I think you're right. Having any risk is difficult, but given the department we have and the complexity, I think we are always going to have risks on there. But it's how we're dealing with those risks, and so what's always been key is taking our team through what they are, and for them to give that reassurance about what we're doing to deliver it. So when you talk about, as guys already said about, it's not really about the staffing there; it's just about the way those conversations take place. But we have put additional capacity in to help deal with some of these risks, like we said before, October 24, in terms of around the dashboards, which I will go through now, but just get that reassurance we are chatting to them, and that's a conversation we had with the team, which was all off record, tell us what's and all was. They are happy with the communication they get, and yes, would all our staff like more money? Yes, of course, would they all like different things there, of course, but in terms of the culture we have, in terms of the engagement work, they're very happy with what we've been said to hold overall. So we're never going to take that for granted. We'll keep working with the teams and to keep communicating, because having been a manager myself since I was 16, 17 years old, I've always said that's the key to everything in terms of your teams, to their communication, telling them what's going on, telling them what your plans are, and make sure you bring people with you. I think that's the culture we have here, and we'll keep doing that going forwards. But
thank you, Councillor Wheeler. Mr. Diesel.
Thank you. I think those points are really important as well. And so we've recognised that there are pressures in the wider system of health and social care in which they impact on us. And so therefore understanding those and working with people, but developing the dashboards is important for us to understand that when we look at figures like this, we're not talking about the same people all the time. So if there were, I'm making this figure up, but if there was 10% of people waiting, they're not the same 10% of people waiting who are the next month and the next month. So actually, whilst it always might be 10%, there'll always be a different 10%. And that's really important, that those people, and we want to assess whether anybody doesn't and does wait a long time, then we wouldn't recognise that through the dashboards, because we'd know them by identified number. I think the other thing is as well that we are constantly always making sure that we look at safety for people, and particularly around safeguarding. And what we don't want is to have a perverse system where people say safeguarding as a way of getting into the system, whereas actually it's not safeguarding, because that makes more work for everybody and isn't a good outcome for people. So we are working on ensuring that everything is safeguarding, is right to be safeguarding. So you'll get some partners who will think actually a way of getting in the front door is it's to say there's a safeguarding issue, when actually it should be their responsibility to do some of the things that they might be doing. So it's about having that oversight grip and looking at the detail to ensure that everybody is getting the best service they can at the time of when we're working with them.
I think you want to speak? Yeah, thank you very much. Yes, all those in favour? Sorry. Thank you. Item 6, Public Health Performance, Risks and Financial Position, Q1 2024 to 25. I ask Councillor Scott Carlton, Cabinet Member for Communities and Public Health, to introduce the report.
Thank you, Chairman. This report summarises the key performance, risk and financial position for public health. For those that have been paying attention, that this is the first time this report has been presented separately to Adult Social Care Committee this morning, following the move of the Public Health team to the Place Department. The future format and reporting governance for public health is currently being reviewed. In Q1, performance of the Public Health Commission services continues to be strong, with the delivery of the majority of the key performance indicators. There were improvements in performance for a number of services For example, the number of eligible population completing a health check, which is increased by 11.9% compared to the same period last year, and our integrated wellbeing service supported 674 people to achieve a 4-week quit in Q1. This is the highest number of people achieving a 4-week quit over the past 5 quarters. Other services continue to perform to a high level, including the Healthy Families programme, where 93% of newborns received a 10 to 14 day health visitor review within 14 days of birth, and by the close of Q1, this was over 99%. There are some excellent stories of difference contained within the report, which highlights the difference and impacts that our public health services are making to residents, and I would urge members to read those if you haven't already. Period 3, budget monitoring for the financial year 24-25 indicates the public health ring-fence budget is currently underspent in year by £155,000. A detailed plan to spend the existing public health reserves, as you may be aware, was recently approved by Cabinet in July. Workforce position for our public health team, not including commissioned services, continues to be strong, with turnover and sickness absence rates low. There have been no significant changes to the risk register, with no risks from the public health currently rated as very high. One area of risk which we are managing is the implication of the Care Quality Commission's special review into mental health services delivered by Nottinghamshire Healthcare NHS Foundation Trust, following the subsequent commissioning of the commissioned by the Health and Social Care Secretary in 2024 under Section 48 of the Health and Social Care Act 2008. As mentioned in the earlier item, NHFT currently provides our Healthy Families programme. This report confirms that they continue to deliver high quality service for the families of Nottinghamshire, and that additional quality and performance mechanisms and financial scrutiny have been agreed in the contract extension until 30th September 2025. Regarding NHFT's broader position, many of you will be aware that the CQC published the final part of the Section 48 review on the 13th of August 2024. NHT acknowledge and accept the conclusions of this report and have confirmed they have improved processes and standards since the review was carried out. I am aware that progress against the broader NHFT improvement plan will be discussed at health scrutiny, as we've already mentioned, on the 8th of October. So we'll focus on the public health service implications today. And at this point, I'm going to draw a breath and hand over to the Interim Director of Public Health, Viv Robbins.
Thank you, Councillor Carlton. So just to add to the introduction that Councillor Carlton has provided, you'll see in your agenda pack from page 100, you've got an appendix with a range of slides that just summarises some of the key public health performance that we wanted to highlight today. And starting with that, what I'm really keen to draw out in terms of the stories of difference is really understanding the impact that the public health services are having on our people in Nottinghamshire, and really thinking around how we're trying to build on some of the themes that we've already had this morning around having that integrated approach to really think about the outcomes that are important to that individual and how we're wrapping around that support in a number of different ways. So the first two stories of difference that you'll see will really talk around some of the work that our integrated wellbeing services had, how it's stretching into working with patients with more complex needs, so some of those with severe mental illness, or those that have tried and tackled stop smoking previously, but I've really struggled to maintain that progress, and how that's really having support on those broader building blocks of good health and well-being, but also thinking around how that's having implications on their medical conditions as well. So the other elements talk around some of the impact that our services are having in terms of how they're reaching into some of those, as I mentioned, those building blocks of good health, or those wider determinants of health. So you will have heard me mention many times around the fact that accessing healthcare services only actually impacts on your health and well-being by about 10 to 20%. And actually, it's all those factors that surround us in terms of how we're born, live, grow and work that actually have a much bigger influence on our overall health and well-being. And I think, and some of those factors might be housing, it might be some of the experiences that you had as a child, it might be the education, the employment experiences that you work. And I think what we're trying to do now is demonstrate how the public health services are having that impact on those broader building blocks of health, not just the core services that we're delivering. And hopefully you'll have seen that in some of the stories of difference that we've presented. We've talked about some of the statutory duties already. One of the things to highlight here is we're having really positive mobilisation of our integrated sexual health service. So the new service will be up and running from the beginning of October, and that's going to really bring together a much more integrated service across Nottinghamshire, which will really enhance some of our patient management systems, a stronger emphasis around health promotion teams and preventing that poor sexual health, and also a really strong online offer, because we know that how people are accessing services is evolving and changing. We've already talked around our health checks, so thank you for that. And then the other area that I'd just like to draw attention to is on page 103, which talks around some of those mandated contacts that we've already mentioned previously. So as you can see from the chart on page 103, the 4 mandated contacts, we have a really high bar in terms of the target that we're asking our healthy families provider to deliver to, with a minimum target of 90%. For those contacts, and what you'll see is that we're either overachieving on those, or the one indicator that we're just slightly underachieving, which is at 89% rather than 90%, is that percentage of 6 to 8 week reviews that are completed. And the team can go into a little bit more detail in terms of some of the exception reporting that we're understanding on there. But just to really provide that assurance that the service that we are delivering for families in Nottinghamshire is maintaining that performance, even though we know that there's lots going on in the broader organisation. And we are also comparing really well in terms of our key performance indicators, but also in comparison to our SIPA neighbours. So those populations that are similar to us, we're having really good outcomes, and that we're still seeing that, and that's really important in terms of making sure that we're getting that assurance moving forward. In terms of the integrated wellbeing service, I've mentioned we've had some of the best outcomes that we've had for the past 5 quarters for stop smoking outcomes, but also for weight management. And in terms of your comment, Councillor Doddy, we're always looking at how we evolve the service and think around how we embed those new technologies, whether it's thinking around vapes for stop smoking, whether it's around thinking around some of the more of the medical interventions for our obesity pathway and our weight management. I'd need to get some specific discussion in terms of the specifics for your question. I can come back to you on a later date or through the minutes if I can, around exactly what we're doing from the service specification for that. But the other area that I just wanted to highlight in here is around we're seeing that increased demand around many of our more vulnerable population. So we talk a lot around those individuals that have severe multiple disadvantage. So they might have a range of factors that are making having the best health and well-being outcomes more complicated for them. So that might be mental health, that might be domestic abuse, that might be homelessness, or that might be substance use. And we're still seeing that strong demand in our services that we have seen post-COVID. So it is just worth highlighting that the services are performing well, but there is a lot of demand there. And then one of the final elements that I just wanted to highlight in terms of this particular report is we have added a little bit more assurance around the statutory responsibility around our health protection duty. So the Director of Public Health has a statutory duty on behalf of the County Council to be assured that we are prepared and we are protecting the health of our population. And you will see in the slide deck that a formal report went to the Health and Wellbeing Board, which came from the Nottingham and Nottinghamshire Health Protection Board, which talks about some of the work that's being done through that board and through the partners in that to make sure that we are prepared and protecting the health of our population. And in particular, there was a further discussion around our immunisation uptake, because that is an area that I'd be really keen to really think around how we can collectively work together to really strengthen. So we know that our immunisation performance generally from an outcomes point of view in Nottinghamshire is strong in comparison to to our neighbours and our similar populations and nationally. However, it is dropping. Now, this is something that we're seeing across the whole of England, but what we are seeing is because our immunisation for things like measles or pertussis is not as high as we would like, that's where we're starting to get some of those infections that we might not necessarily have seen before. So I suppose it's just something to really think around in terms of how we can strengthen some of that role, and we are doing further work within the team to think around how we can target some of those populations that may struggle to engage in services in a different way to support some of that. So I think those were some of the key things that I wanted to highlight, but happy to answer any questions if there are any.
Happy to hand back to you, Chair.
Thank you very much. Any questions? We've got Councillor Carr.
Thank you. Just like to pick up on your point about immunisation before John Doddy does. I think we've got a serious situation, particularly with measles. I think with the present generations have become sanitised from these sorts of illnesses. My parents' generation, my mum would have been 100 on the 22nd of September this month. Now my dad would have been 103. Their generation grew up with these diseases before they had vaccinations for them. So they would have all known somebody that had diphtheria or whooping cough or polio, for example, and measles. My cousin, who's now 78, is deaf in one ear because he caught measles when he was a child. People don't understand how bad these diseases are. We've had whooping cough going round, and my neighbour caught whooping cough, even though as a child she had all the jabs and everything. She's had her cough now for 120 days. And if a child gets that, or even a baby, that's a big risk. But how we get that message across is extremely important, and I think and I'm sure everybody agree that this is something that we can all get behind because it's such an important issue moving forward, particularly with the health of children and the future health of adults.
Thank you, Councillor Carr. Councillor Carlton.
Yeah, I was going to say just very quickly before I hand over to Viv, I absolutely agree with you on that point. Also, we saw during the pandemic some of the continued emergence of social media, particularly the influences, what that may or may not be having. I know, for example, when Councillor Doddy started the water fluoridation campaign, we saw it from an evidence-based point of view, but again, there's always that counter argument that can sometimes be, dare I say it, to the risk of being quoted in the press, of course, misinformation. But absolutely, if committee would play into that role, I would support that. So, Viv, over to you.
Thank you both for your comments, and I think there is something for me about just really reiterating that some of these infectious diseases are absolutely preventable. We have highly effective and safe immunisations for these infectious diseases, and it's because we're seeing that drop in immunity in our population that we don't have our herd immunity or that protection for those that can't have those vaccines, and that's why we're seeing those. And I'm sorry to hear around some of the local cases that you've heard. I think one of the things that I would really emphasise as well is the importance of also having some of those vaccinations in pregnancy, because particularly if we think of whooping cough or pertussis, we know that where in the older population it can be uncomfortable, and you can have, like you say, the 100-day cough. But for our infants and our children under 1, that's where you can unfortunately see some really fatal and some really tragic cases, and the vaccine is strong and effective to prevent some of that. So really keen to work with you all around how we can do some further work around increasing our immunisation uptake, and if there's anything that the team can do to support you, then we'd be more than happy to work with you on that.
Thank you very much. Ms Robbins, can you just respond to Councillor Doddy's question now while we've got the opportunity as well, please? Completely. Yeah.
as completely as she can.
Okay. We'll move to Councillor Pringle. Yeah, Councillor Owen.
Thank you, Chair. First of all, thanks for bringing this. Recognised. I have one question, or 2 points to raise. First point is printing Appendix C off, as it is. You know, it's not the first time, but split it in two so we can read it, or let's look at doing something different so we can read it, other than having laptops with us. Also, I've lost my page, sorry. On Appendix B, prescribed children's services, paragraph, well, I'll come down, 1, 2, 3, 4. In the same quarter, 94% of infants have received 1 year health development by the age of 15 months. So 6% hadn't, and then the details then been cancelled. Has it been cancelled, or have we moved it into somewhere else? Because that means to me that we've got 6% of kids out there that have not had any contact, which is a worry to me.
Councillor Carlton.
Thank you. I was going to say I will take the first question on hand over on the question regarding children's services, but certainly that request is noted. But actually, from where I'll just refer back to my opening comments around the reporting and format governance for public health, as I say, is being reviewed at the moment. Obviously, that's just a small aspect of that. But I would equally be interested to see how committee this morning going forward would like to see some of this information presented, whether you find the stories of difference helpful or not, percentages and figures helpful or not. But I'll hand over to Viv on the second point.
Thank you. I was actually going to hope to hand over to Helena if that's if I may, because she's got the detail on that.
Yeah, thank you very much. Yeah, just to confirm that data is that by the close of the quarter, 94% of infants have had their 1 year review by the time they turn 15 months. So the service will continue to make every effort to contact that family to deliver that review. So that would include a number of attempts to contact that family to offer that review in different ways. And there is a very detailed was not brought policy. So for example, if a family was a safeguarding family, that service would make every effort to deliver that review, including turning up at the home and trying to reach the family that way. We have exception reporting, so we get a sense of why those reviews have not been delivered by 15 months of age, and we've included some of that detail in the appendix. So that might be that parent has cancelled the review because it wasn't convenient and rearranged it for a later date. It might be because parents didn't attend the review. On occasion, it's because parents have actively declined the review, so they've opted out of the review. When we've interrogated that, we've found that usually that is a parent who has a number of children already and feels very confident that their child is developing well, or they might be in an early years setting, for example. But just to provide that assurance that families that are assessed as having either a safeguarding need or a targeting need, every additional effort will be made to reach them.
Thank you very much. So I've 2 more speakers. Propose after those speakers that we go to the vote. So, Councillor Owen.
Yes, Chairman, I wanted to come back to the question of vaccination, and we heard from Councillor Carr about the issues facing the non-take-up of measles vaccines, and this, I think, is still a continuing problem from many years ago with the adverse publicity surrounding MMR, which in my view was very, very badly handled by the NHS and doctors at the time, and I think there's still a leftover from that. But one vaccination I wanted to pick up, and perhaps you can explain this to me, something that I didn't realise was on offer. We've now got the RSV vaccine, or at least certain people have got the RSV vaccine. I'm just looking at the NHS vaccination webpage, and it says the RSV vaccine helps protect against respiratory syncytial virus, a common virus that can make babies and older adults seriously ill. And in fact, we've heard on the television that a number of older people do die from this condition, and therefore it's recommended during pregnancy and for adults aged 75 to 79. What happens when you become 80? Don't you die from it? You aren't eligible for the vaccination. Why is that the case? Is it as simply that the government, as we know, have written off older people? They're quite happy for 4,000 a year to die by removing the winter fuel allowance. Are they now also happy for older people to die from respiratory syncytial virus?
I'm going to hand straight over.
Thank you for your comment, Councillor Owen. So you're right that there is a new vaccine that is being introduced, so the RSV vaccine from this season, and that is very much targeting those that are at greatest risk. So we know that those that are very young and that those are in their elder element of their age are at highest risk. When new vaccinations are embedded, this is a national discussion that is led by the Joint Committee of Immunisation and Vaccinations, and they look at all of the evidence base which talks around where the vaccines will have the most effect, but there is also discussions around cost effectiveness in terms of how they roll out the programme, but also in terms of where they can have the biggest bang for their buck, and those are the discussions that are ongoing. So we have those conversations regularly around the eligible populations for flu vaccine, for COVID vaccination, and those sort of things. So certainly we don't make those decisions locally. They are taken at a national level, and then they are brought down to us, and then we have to work with our health colleagues around and our service providers around how we implement those decisions. So unfortunately, I can't give you quantification in terms of. I'd need to go back to the joint Committee for Vaccination and Immunisations in terms of their justification for that particular age group, but I can unpick that and then send you some further information if that's helpful.
I would be most grateful for that, because at face value this looks quite disgraceful. I think you use the word cost effectiveness. Putting it another way, when you get to 80 you aren't worth spending any more money on.
Would you circulate that to all members, please? Yeah, thank you very much.
Yes,
Councillor Martin.
Yeah, thank you, Chair. I just want to pick on a couple of things. So one is, I've been banging the drum about this for 5 years now, several arguments with Jonathan, debates with Jonathan Gribbin about it. NHS health checks, right? I'm sure Councillor Doddy will concur with me that the delivery model is completely inappropriate, and I don't think the primary care sector really need to be handling it. And I think a better service delivery model for that would be to run it through health centres or the hospitals on like a screening programme methodology. Because obviously, and the reason I pick up on it is because I'm from Ashfield, as you know, and people in Ashfield and Mansfield live 10 years less than people in Rushcliffe. And I bet you diamonds that the link is intrinsically linked to the people taking up the health checks in Ashfield and Mansfield compared to people in, say, Nottinghamshire and Rushcliffe, because I bet they're all on point and turn up. And I think the delivery model is completely wrong. And seeing as they're doing a review, you've even got, it even says that you've got people, practices have reduced their delivery and are considering stopping it altogether. You know, and I think if we're spending public health money in the right way, in partnership with the NHS to deliver health checks, which is quite an important thing for people 50 plus, then I think the delivery model seriously needs to be looked at, and I think the screening programme methodology would be better handled by the NHS and health centres as opposed to primary care. My other point is about the substance misuse. 20% completion rate in March 24 to the change. Is that Change Grow Lives national performance there? 2,525 adults are currently in treatment and 119 young people. The service is over capacity by 406% from the original contract numbers. What are we doing to mitigate that issue?
Thank you.
Councillor Carlton.
Thank you. I was going to say I will tackle the substance use question, and if I hand over to Viv around the first question. Obviously, over this last number of years, as you'll be well aware, that we've made significant progress with the harm to home strategy. The last government put in in 2021, I think it was, to increase that treatment offer. So obviously, to refresh memories, as a council, we commissioned just over £9 million with CGL. And over the last 3 years, there's been approximately £8.3 million awarded to, as I say, create a world-class treatment provision, but then also to increase capacity. It should also be noted, obviously, that is in the terms of completed, but equally, how do you sometimes define the word completed? For example, a couple of months ago, along with officers and representatives from CGL, which included a service user, met with the Office for Health Improvement and Disparity and the Joint Combating Drugs Unit across, I think it's 12 to 13 Whitehall departments. As part of the individual story, if you like, that 20-something years ago, actually in Ashfield, that he started using Class A drugs. Naturally, his world around him fell to pieces, personally, relationships, household, work, etc., etc. And obviously, as Viv referenced earlier, within this severe and multiple disadvantage cohort. Obviously, in more recent times, he had accessed the service, got himself, for want of a better phrase, clean, onto the straight and narrow. However, as part of his, if you like, inverted commas, treatment moving forward, is that he volunteers within CGL now. So in the terms of his treatment, that is still, from a technical point of view around percentages, is still ongoing. And he's been doing that for a number of years now, because he thinks his view was very much of, I've received all this help, it's got me back on my feet and my life turned around, I would like to put something in. We know, certainly within the world of substance use, as I've made reference around the level of support over the last 3 years in building additional capacity. I put a big caveat around that ends in March 2025. I sit alongside some of the domestic abuse funding as well. So there is a concerted attempt by colleagues here, regionally as well, and across the country, within the drug and alcohol partnerships, particularly to lobby central government for that additional capacity. That was multi-year funding that allowed us to put a system and develop structures, increase capacity, and that there is a risk, if you like, of having to walk some of that backwards, particularly when we know, as you may have referenced, seen in local media, around the changing world of drugs, particularly around the synthetic opioids that are hitting the streets, particularly as we continue to experience some of those heroin droughts coming in from Afghanistan. That gets to the very nuanced point around substance use that we all know heroin is bad, and obviously creates a life of addiction, but particularly when you start to see synthetic opioids, particularly some of the more well-known ones, if you like, around fentanyl, which obviously, and you have to look at the situation in the United States, that there's clear evidence of it landing on the streets in the United Kingdom. You only have to take a very small amount of this mixed in with another Class A, maybe heroin, maybe cocaine. Maybe the street dealer doesn't even know it's in there, it's been laced, and it has the power to kill. Obviously, a few weeks ago, obviously you may have seen the media reports around an incident in Nottingham City Centre, for example, that 4 individuals were hospitalised. So I'm incredibly proud of the record of the substance use team here at the County Council. In some cases, nationally, they are trailblazing, but they are some of the wider risks at this moment in time.
Thank you. So thank you for covering the discussion around substance use, Councillor Carlton. So if I can just go back to a question around health checks. So we did bring a report on health checks about a year ago, I think, to this committee, and it's to provide that reassurance that we're still doing that work in the background around what is our service model, how do we commission the best service from a health checks point of view for Nottinghamshire moving forward. We have done further work in terms of work around the health equity audit. So that's a piece of work where we're looking at where is the health checks being taken up and where are they not being taken up. So and then what can we do specifically to make sure that people that we know have the greatest need can then take up some of those health checks. So we know that there are discrepancies or inequalities in terms of between the north and the south of the county. Which we would expect in some respects, because we know that if you are from a more deprived background, then quite often you are less likely to take up your health check offer. But now we're doing a lot more targeted information, and we're very lucky within the local system that we have a system called eHealth Scope, which pulls all the information from the back of the GP system, so we can really understand that granular detail in terms of where are people having health checks and where are they not, and then how can we work with individual GP practices across Nottinghamshire to support them to really take up health checks in a different way, because we know there's some areas of best practice where some GP practices have really gone for it in terms of health checks and had seen some really positive results, and we know other areas in terms of GP practices have struggled in terms of their broader impact of the demand following COVID, but also the broader service demand. So there's the work that we're doing locally, but then there's also broader work that's happening around health checks nationally. So there's a range of pilots around how can we deliver health checks in a different way. There's a number of options that we've looked at previously in terms of how you could deliver health checks. So whether it's through community providers, local providers, general practice, those sort of things. So we always look at those when we are going out to re-procure. But I think the other thing that we just need to keep a bit of an eye on is looking at some of the emerging evidence around the digital health check. So there is potentially a different way to deliver health checks, which could, once we see the evidence base to see how effective it is or it isn't, we could look at potentially delivering a service later on. So we have got health checks. So that's sort of where we are for now. What's really positive is that we've seen a nearly 12% increase in health check uptake between this quarter one in 24-25 in comparison to 23-24, which is really positive because it shows us that general practice is recovering and starting to reprioritise some of the health checks performance. So from my point of view, I think that's a really positive thing. That doesn't mean that we haven't got more to do, but what I can make sure is that I'm pretty sure we've got health checks on the forward plan. So when we know a little bit more around what's happening nationally, and we've done a little bit more work around that health equity audit, so really engaging with particular populations or particular practices, we can come back and have a much more detailed conversation around what we think the future of health checks might look like, if that would be helpful.
Ms Robbins. Councillor Carr, it's after 12:30.
Yeah, just very briefly, going back to the delivery of health checks, some of you may or may not know that I had to have an operation to remove melanoma, and I had it done in my GP, and so my GP had a captive audience for about 45 minutes, and he was very, very vociferous about the new GP contract that's coming up, and how that could be as devastating to GP services as the dental contract was in the early 2000s. And I did ask at a previous meeting whether we could have a look at this on the work programme. I don't think it's on there, and I think it's very, very important, because my understanding is it could have a big impact on the delivery of items such as these. Thank you.
On that, Ms Robbins.
Thank you for your comment. So I think certainly we need to understand what's going on around general practice delivery overall to understand what the implications would be. The specific contract for delivering health checks is separate to that broader NHS contract for general practice, and we can commission them directly from the local authority. So there's a slightly different procurement approach for that, but that doesn't mean we need to understand the broader system that sits in. One of the things that I would say is is because I think that would be a really good discussion to have with our ICB colleagues around understanding that might be something, because it's that broader health system conversation that that members may want to consider in terms of that broader work programme for the Health Scrutiny Committee. But certainly when we're reporting progress from health check specifically, we can make sure that we put in some further analysis and some further comments around that, if that would be helpful.
It's one for health, Councillor Carr, that one. First,
Yeah.
to bring up any areas of consideration.
Just to line up with what we said about adult care performance requests for whole numbers, we'll definitely work with the department to make sure you get that, and also that the guidance around the RSV vaccine from the Joint Vaccine Council is circulated to members when people send it through to us. Thank you very much. So just to note, this is a new work programme. This is the work programme that was approved at Overview Committee last Thursday, and we went through the new process of doing it where all members were given the opportunity to contribute. So it is pretty full, but that's the work programme for this year. And it's just to note, if you have got any additional suggestions, let myself and the chair know, and we'll have a look at if that's an area that can be considered. And just to reaffirm what people were saying, the NHS health check programme is on there as an item to be scheduled. So when there's a bit more firmness in that area, that's something that can be considered.
Thank you very much. So we can now meeting. Thank you for all of that, Kerry.